One of the most valuable things that I've done over the last year, the first Sunday morning of every month, I go out to our apartment complex. It's about 3 miles from my house, and I have breakfast with a bunch of folks that live at our Kirkland Roads apartments. And one of the things that we would talk about, it was not therapy by any means. Gosh knows I'm not a therapist. But it was not therapy. It was a time that we just sat around outside, and we did it in 24-degree weather. We did it in 90-degree weather, rain, sun. It made no difference. And we pulled tables out in the parking lot and just sit around and eat breakfast. And I learned an awful lot. And there are a couple of things that I wanted to share. One, that people want jobs. People. And when we started to talk a little bit about what it would take for them to get jobs, they would say, we're nervous about that. How do we interview? Who can help us do those kinds of things? We don't have clothes to go and interview. We don't have the access to job coaches. How do we build a resume? How do we do all those things? And then one of the biggest fears that came up was, just meeting with people about that. How do you go and talk to somebody and tell them that you're ready for a job? And so I want to share a little story with you about this job for me, because I was scared to death. And I got a phone call from somebody that I knew who worked at the governor's office. And I'm not somebody that knows Governor Deal or knew Governor Deal. I've now met him on 3 different occasions. And I can tell you definitively that he is passionate about doing the right thing to help us. And I wouldn't have accepted this job had I not felt that way, because I had a great job. I had a 3-year contract with the agency that I was working with. I had a great job serving people, serving about 11,000 people a year, and I felt rewarded. And then I get this phone call, and the phone call was, would you be willing to talk to some people at the governor's office about what's going on in mental health in the state of Georgia, behavioral health and developmental disabilities in the state of Georgia? And I said, yeah, that would be okay. And before I knew it, I went and I met with a gentleman by the name of Bart Cobile, who is the governor's chief operating officer. And we just sat down and we started talking, and he said, we're looking at the department and things like that. And I gave him 3 names of people, because he asked me specifically, do you know some people that would be good commissioners? And I gave him 3 names of people that would be wonderful, wonderful commissioners. And he looked at me and he said, well, are you interested? And I kind of looked at him and I said, really? I had never thought about that. So after that conversation, it went well, and he said, well, look, if you're interested, I'd like for you to meet with Governor Deal. And so I said, okay. And I got a resume together with some help of my support network. And I got a resume in, and I went down and I met with the governor. So here's what I want to share about that story. So I get to the Capitol about a half an hour early. I didn't know what traffic would be like. You don't want to be late for the meeting with the governor. I get there and I check in, and I've got a little bit of time, and the receptionist says, well, would you like some water? And I said, no, I'm good. My throat was, even though it was dry, nervous as can be. So I've been in your shoes of being extremely nervous about that. So I go downstairs, and I'm usually not one that gets real nervous. So I go downstairs because I wanted to look good, and I went to go and tuck my shirt in. So this is no lie. I'm downstairs in the bathroom at the Capitol, tucking in my shirt, and I go to zip up my pants, and my zipper gets stuck. My zipper gets stuck. And I'm pulling up my zipper. And it's not zipping up. And I'm going, okay, well, I have a feeling we will sit around a table, and I'll button my coat, and I'll be able to pull up underneath, and nobody will notice. And I'm like, then what happens if we're not at a table? What happens if we're sitting around in chairs like this? And so now it's getting to be like 10 minutes before I'm getting ready to go in to meet the governor. And I'm like, I can't believe this. I simply can't believe this. And so I'm still been, and it's hot. It's like the middle of June. And I'm going, oh my gosh. And so I yank as hard as I can, and I'm expecting the zipper to go flying across the bathroom, and it doesn't. And it pulls up. I can do this. So I went in, and the reason I'm sharing this story is that I was scared. Something bad happened. Have you all ever experienced anything like that? But I went ahead and I thought about just leaving, and I said, no, you can't do that. So I went in and I met with the governor, and I had never met the governor before in my life. So we go in and we start talking about, he says, tell me what we can do better in this state. And so I was good to go, my zipper was up, ready to go. So last night I heard something, and this was key to this, communication. There was somebody, I believe it was from down in the Thomasville area, who said, we don't know what's going on in the state. Well, I've been a provider in Georgia for 17 years, and I'll tell you a little bit about my background in just a minute. But one of the things that was most frustrating to us as a provider, and we were one of the larger providers at Viewpoint Health, formerly the GRN Community Service Board, was that we never knew what was going on. How were decisions made that were impacting, the way we delivered services? And it was one of those things where we were kind of just told, this is what you're going to do. And there would be times where we would say, but that's not what the people we're serving, that's not what would help the people that we're serving. Why would you do that? And there were times where we would be told, because we're the state, and that's how it's going to be. And so I started thinking over, the last several years, if I were in that position, I would do that differently. So now I'm kind of like, okay, you gotta put your money where your mouth is. So communication has to be better, and that's a #1 priority for us. Communication has to be better, and we need to pull in people who are the real experts, and that's you all, and people that work with you, to tell us really what we should be doing to help. Because I went to school a long time ago, and even though I went to school, the schooling that I had did not teach me what you all have gone through and what I've gone through. So there's no amount of reading and writing and arithmetic that can help us figure this out. It's real life experiences that can help us figure this out, and you all are the experts in that. So communication, and we need to do a better job of communication being a two-way street. It comes from the department, and then it comes from the ground level up. And somehow those two things have to meet. And then we have to figure out how to do things in a better way, communicate that. The other thing that I talked to the governor about was, I mentioned jobs. And I said, when I work with our folks, and what I hear all of the time is that people want to work. And I was fortunate because the day that I found out that I was going to be doing this job, I had an opportunity, he's already been up on the stage, to talk with Michael Lincoln. Mike and I had a great discussion about employment and things like that, and Mike said, I want to do more to help with this. I know it's a problem. And so, we were fortunate that we had a regional coordinator who was passionate about trying to figure out what to do and how to do it and work with providers. And I think across the board we can do a better job of people working with providers who ultimately can help deliver services that can help us with employment and housing and other things. But my 12-year-old, from an early age, even 2, 3, 4 years old, people are trying to figure out how do you have the ability to get what you want. And so employment is part of that. You know, 12 years old, my oldest daughter is babysitting now. And she babysat for this little boy that was a huge handful last Saturday night. And she babysat for 5 hours. And this little boy was just a challenge. And so we said, you know, would you do that job again? And she said, well, for $60 I would. but people want to work. And there's no reason that we all shouldn't be working. And so that's not something that we should take for granted. So what I talk to him about is that I've experienced with a couple of people that I've worked with is the need, and it's already been touched on. So I'm not bringing up new things. Is physical health care. And I've worked with a young man out at our New Rock apartment complex and had some pretty significant behavioral health issues, but equally as important were his unaddressed diabetes. And when that was left untreated, it would impact him in such a way that he would go into crisis and go into Georgia Regional Hospital. And you know, when he wasn't there on a Sunday morning, it bothered me. Because where was Stephen? Well, Stephen was at the hospital because of his behavioral health issues, but then we found out that the week before he had been in the emergency department for his unattended physical health care needs. And one thing led to another, and then it ultimately ended up in Georgia Regional. And then I got word from our director of our housing out in Newton County that we weren't sure whether we could keep Stephen because of the physical health needs, and he had his own apartment. And so one of the things that we started to work on was an integrated system, and Mr. Fricks talks about that and the importance of that, and how everybody in here and everybody in general, my children, need easy access to high quality physical health care. And we should expect nothing less for that than for us. And so we're gonna fight for that. And I talked about that issue at my first board meeting. And the other thing that we've started to get into a little bit is children's work. And that there's got to be a new priority put back on children. It's been a long time since we've devoted energy to children in this state in a meaningful way. And that means across departments. And so, you know, how do we provide supports to children and their families so that they can lead a life of independence and recovery, which is what we all want to have. Exactly. And if we don't start at an early age, we're going to end up seeing them in a lot of different ways, in a more significant way of need. So we've got to do a better job with that. So I want to tell you a little bit, it's easy, you know, to come up and people say, okay, that's our new commissioner. I do want to tell you a little bit about my background. And then I want to finish up with hearing the goals again, because Judy Fitzgerald is here. Judy and I have worked together for a long time, and Judy's agreed to come work with me down at the department as the Deputy Commissioner of Programs. But Judy says, you know, these goals are really our job description. They're really our job description. That's what we need to be fighting for. That's what we're going to be held accountable for. And so I want to revisit those. But I started in this field about, believe it or not, it's been 24 years. And I always thought, gosh, what would I be doing in 24 years? Maybe I'll be retired. That's not the case. But 24 years ago, I started working in the public school system in Florida, in Tallahassee, Florida. And started working, my background is in child development and family relations. And I started working with children because I loved it in an elementary school that I worked in when these little kids, the little kindergartners, would come up and kind of pull on your shirt, can you help me, can you help me? And when you help them, you know, you get a smile from it. And it was a rewarding feeling to feel like you're helping somebody. And so for about 18 years, most of my career was devoted to working with children. And I spent time in the school system in Florida, and then I moved to the rural mountains of North Carolina, where I did case management for children who were in what was called the Willie M. class action lawsuit in North Carolina. And those were North Carolina's most violent and aggressive kids. And what I found was that when you treated children, whether they had a behavioral health issue or a developmental disability or whatever it was, when you treated children as children and you gave them the same opportunities that you gave any other child, that they did well. That these kids that we worked with who had pretty much been put in the juvenile justice system or in the social services system or wherever it was, that when you took them canoeing, when you took them camping, when you go on outings, when you do so, they did great. And so, my background, again, being child development, when you treat people with respect and dignity, you get respect and dignity back.
Yeah.
That's not a real... You treat people the way you want to be treated. And so, over the years of doing that in North Carolina, being a single male in the rural mountains of North Carolina only lasts for so long. So, I moved down to Georgia and came to Rockdale County and worked with the Community Service Board, Children's Services, and over a little period of time doing that. And when I first came to Georgia, I started out making $21,000 a year. And so I say that because I started at ground level. I started in basic case management, and I never thought that I would be standing up here in the role I'm in. It is an absolute privilege and honor to be up here in this capacity. So over the next several years, I then was approached to go and work with the Department of Juvenile Justice. And I headed up their mental health services for DJJ. And I saw a lot of kids in the juvenile justice system that, had we given them appropriate supports earlier on, probably would not have been in the juvenile justice system. And I also know that as a kid growing up, in today's world, I probably would have been one of those kids in the juvenile justice system. My mom says, you were a handful. And I probably would have been one of those kids. But we've so criminalized things in the juvenile system, in the youth system, that I don't know that we're being fair to kids. So I did that for a number of years. Something that I do want to share. I left the juvenile justice not in the best standing. I was actually fired. Technically I resigned, but I was actually fired. And I thought that was it. That's the end of the road. I've got to go and work in a grocery store, which is what I did in high school, and it was probably one of my favorite jobs of all time. I worked third shift in a grocery store in the panhandle of Florida, and it was one of my favorite jobs of all time because I stocked shelf and I buffed floors. And the reason why I liked that job so much was because you could come into a grocery store in the middle of a tourist area, and the grocery store was an absolute disaster at the end of the day. And you'd come in, and you were able to get the shelves looking perfect by the next morning. You could, and the floors, you could put a coat of wax on the floors. And I'll never forget just buffing floors and going back and forth. And that was almost, now that I know this term, that was almost therapeutic for me. I had a lot of chaos going on at home, and it was a place where I could just walk back and forth with this floor buffer. And I remember doing it, holding it with one hand and squirting the wax with the other hand. And it was probably one of the most calming jobs I've ever had in my life. And I loved that job. And to this day, I still think back of blocking, we called it blocking those shelves, where you would pull the cans forward and put the old cans in the back and buff the floors. And so I thought maybe that would be a job that I could go back to, but that wasn't the case. I went back, and I was fortunate enough to be able to go back to the GRN Community Service Board and start, again, trying to figure out how to help people. Because that's really what my strong desire was to do, was to continue to help people. And so I did that for a couple of years and then became CEO of Viewpoint Health. And I want to just finish up with this book. I had a 3-year contract. My children said to me when I talked to them about doing this job, he said, well, Dad, why would you do that? You told me you were so excited when you got a 3-year contract with your current job. Why would you do that? And I said, well, guys, there's some times where there's a bigger picture. So we were serving about 11,000 to 12,000 people a year, and I'm talking to my kids about this. They're 12 and 8. And I said, if you can ever have an opportunity to go from serving 12,000 people to possibly helping 400,000, how can you say no? And so my older daughter was old enough to remember when I left the Department of Juvenile Justice, and she said, well, what happens if you get fired again? And I thought about that for a minute. I said, then we'll figure out what to do next. But you have to take chances. You have to take chances. And so I want you all, some of you stood up last night and asked questions, and that was a chance. What happens if you got up there and you kind of froze? It would have been an embarrassing moment. So what? You took a chance and you got up there. You took a chance to come down here and be away from home and be away from your normal daily activities. You have to take chances sometimes. I'll finish with this point. I said to the governor in the last time when I met with him, I said there's 5 things that we have going for us, and we need to make sure that we bring in the 6th thing. I said, or the 4th or the 5th. I said, first of all, you have a Department of Justice settlement agreement that is overseeing us right now. That's not a bad thing, because you got some oversight. So that's good. You have a legislature right now that's putting millions of dollars into our system. And we have a responsibility to make sure that those millions of dollars are being spent on services that we collectively feel can be helpful to us. And so we've got millions of dollars. We've got an advocate community, and we've got a provider community who are willing to sit down with each other and talk about what's going to help folks. And when I say advocates, people like us are on some of those advocacy boards and have a voice, and we're willing to sit down together. And then you've got, most importantly, a governor who is deeply committed to our cause. So you've got a governor deeply committed to our cause. And he demonstrated that at the State of the State address. He demonstrated that by saying, I'm going to put $10 million into treatment courts so that we can keep people. That's putting your money where your mouth is. So that's huge. The piece that now I'm responsible for is making sure that the Department of Behavioral Health and Developmental Disabilities is a partner in all of those things. And how do we become a more valuable partner? How do we become a voice for all of us? And I do feel that it's a huge responsibility. The last thing I'll say, and this, I promise this will be the last thing, was yesterday on the way down, I had an opportunity, and I've been there many times, but I had an opportunity to stop in Milledgeville at Central State Hospital. And we took a tour, and we walked into the main entry building, and I stopped for a minute and looked around, and there were pictures of old men up on the wall. And I just thought for a minute about the 100+ year history at Central State Hospital. And what all has gone on that campus. And I know some of you have been there before. What I saw when I pulled up was some old buildings that need to be torn down, but I also saw a beautiful campus with trees that were probably 200 years old, and some green space that was absolutely beautiful. What I don't want to do is just say we're closing a hospital to be closing a hospital. What I want to figure out is what can that place become next? Because I think it would be a tremendous disservice to all of those people that have gone to Central State to just let it become what it's becoming right now. I don't ever want to have a place where that's where you send people, where you get rid of people. But how do we make that place something different? I mean, are there other opportunities that may not have anything to do with the work we're all trying to accomplish? Maybe it becomes a community place where people that has, you know, bike paths and things like that. And then when we were finishing up, we drove by the cemetery, and you saw the stakes, and you hear about the 25,000 people that are buried there, who may have never left there. My mom grew up in Atlanta, and she said, I remember growing up, and we were told, if you misbehave, you're going to Milledgeville.
Yeah. Yeah.
And how do we start changing that reputation so that 100 years from now they can say, Georgia shut down the mental health hospital, the psychiatric hospital, but look at what they did with it now. And it's now this thing, whatever that thing may be, and it's something that we're all proud of. So I do want to give attention to that. Again, it was a little overwhelming walking in there, knowing that now this is kind of my responsibility to figure out how to work with folks for us to do better as a state. I think we can do better. I think we can do better. I have a lot to learn. I'm going to learn from you all. I learned from my friends at Viewpoint Health. They taught me an awful lot. They're going to still continue to teach me. I have a lot to learn. Fortunate that we have Mark Baker, who works with me. I told Mark last week, Mark, you pull together whoever you want to pull in, and you tell me when to be where, and I'll be there. You tell us what your office needs to look like, and I'm not talking about the physical office. I'm talking about the global office of recovery. And that may or may not be that may or may not be the long-term name, Office of Recovery, but maybe it is. But whatever it's going to be, I don't want it to be a time when, oh yeah, they talked about this stuff, but they didn't deliver. What are we going to do? What are we going to do that in 6 months people say, there's a difference, we're feeling a difference, we're feeling better about the direction we're going. So I would invite you all to continue to dialogue with me and with our department. I'm thrilled. The first 9 days have been fantastic. Fantastic.